Hello, I'm Michelle Bullock, licensed massage therapist in the state of Washington, and my channel is all about helping you to pass the MBLEx and become a licensed massage therapist. I decided to start this channel because for myself, when I was studying for the massage and bodywork licensing exam, I found that it was a lot easier for me to listen to podcasts or watch videos about the topics and then just do as many practice tests as possible rather than cracking open my books and going through PowerPoint slides. It's just not the way that I study. I have a little bit of ADHD, so I need to be active. I need to be doing something when I'm studying. So activities or listening to something while I'm doing something else was much more my style. I was also working, so I was able to put in my headphones and listen to people talk to absorb information while I was doing my jobs because, I haven't grown up and I have a life. And sitting in a library studying was not something that was possible for me. I want to be able to participate in that ecosystem that got me to the point where I could become a licensed massage therapist. Today, we're going to be talking about the 3 highest scoring topics for the massage and bodywork licensing exam that are not technical. Now, we've got 4 topics that account for at least 15% of the information each. But I'm taking away the benefits and effects of massage because that's a lot more technical, a lot more sciencey. And instead, I'm going to focus on the soft sciences, which are client assessment, reassessment, and treatment planning, guidelines for professional practice, and ethics. Just a couple weeks ago, I did an ethics presentation that goes into a lot more detail about what you need to know for the ethics section. But I'm just going to do a quick overview of the soft stuff that you'll need to know. Altogether, it accounts for 47% of the MBLEx. If you can ace this part, no matter how nervous you feel about anatomy and physiology and kinesiology, if you can ace this part, you are well on your way to passing the MBLEx. So remember that, okay? So the first section we're going to be talking about is the client assessment part of the MBLEx, which is 17%. 17 out of 100 questions are going to be about that. So the first section we need to talk about is the organization of a treatment session, how you set up treatment, thinking about their safety, looking at their forms, and managing the time. So as far as safety and comfort goes, you need to ensure that the client feels physically and emotionally secure from the moment that they arrive in your space. This includes adjusting the room temperature, making sure the music's right, making sure the lighting's right, and making sure everything's clean and organized and tidy, and it feels like a massage therapy space. Before they even get there, when you're setting up the space, you get out intake forms or, paper forms, or you're looking at the digital copy of their previous sessions with you or with another therapist, and you're making sure that you have as much information as possible before they sit down. They're going to expect that you know a thing or two about them before they come in and sit down in your room. They won't expect to be able to just get started. They're paying a lot of money, so be considerate of that. And if it's a clinical space, then, they're going out of their way to make sure that they arrive on time for you, and you need to make sure that you're prepared for them. So make sure you review those forms before they get started, or on their first treatment, you're looking at their forms very thoroughly and asking all the best open-ended questions. And then adapt your session so that you respect their time and so that you're mindful of your time, you're mindful of your next client's time. So the test is about making sure that you know how to manage your time when you're going through the treatment session. And make sure that there might be some questions about if a client arrives late, then how are you going to adjust the session? You want to make sure that everything stays safe, but also you're going to have to adapt it. Okay. So let's see. A question, an MBLEx-style question regarding how a treatment session gets organized. A massage therapist is preparing for a returning client who mentioned low back pain in a previous session. What is the most appropriate action before beginning today's massage? So let's look at the important details of the question real quick. Returning client mentioned low back pain in a previous session. So what are they going to do before the client shows up? So what are they going to do before they start? So A, just get started with deep tissue techniques to address the area immediately. B, ask the client to change clothes while you prepare the table. C, review previous session notes and ask if the condition has changed. Or D, skip the assessment since you already know their history. So doing a reassessment is like, it can be really quick. I'm talking about response D. Doing a reassessment can just take a couple of minutes. Has anything changed since your last session? How's that low back feeling? Do you want something done on it? And then you can reassess your plan from there. It only takes a couple of minutes. B, ask the client to change clothes makes no sense at all. A, just be like, I'm doing this now without talking to them ahead of time, just getting started on deep tissue massage. Not appropriate. We talk about everything that we're going to do in the session before we start. Only takes a couple of minutes, and we get consent for that before we get started. So C is the best choice out of all of these because we want to find out if anything's changed, if we want to go ahead and work on that in this session and get informed consent from that client before we get started. So we talked a little bit about professional communication in the last aspect that we were talking about, but we're going to talk about it a little bit deeper. We need to explain the treatment plan using plain language that the client can understand. We don't have to get too technical, just enough professional communication to display that we know what we're talking about, outline what you would like the plan to look like, and encourage feedback from them. That's not going to work for them in some way, or encourage them to ask questions about how that's going to go if they have them. Make sure that you get that consent before you get started doing something. Even if it's just, do you want the usual that you usually get? For those of you who are like in a spa scenario, or for those of you who have gone past the deep treatment work and you're like kind of just going in the maintenance massage. I have a lot of clients like that now that we're just doing maintenance. Like, do you want the usual? And they're like, yep, they know what they want. So we got that. But there are some areas of the body and some techniques that you're going to need written consent for. So make sure and check your state laws. There might be a question regarding that, whether or not you need written consent for something. So make sure that you're aware of that. And then adjustments and referrals. If something changes in mid-session, or like the techniques that you're using are not working for the client, or what you're doing doesn't seem to be effective, then you are going to need to make adjustments. And you just talk about that when they're on the table and you just do it. And also at any time, they can say, I just don't want to do this at all anymore. I need to get up. And you need to skedaddle and let them get up and get dressed and respect that. But if what the client needs is outside of your scope, you need to be able to explain to that client why it's out of your scope for whatever reason and make suggestions to them about who they could go to. If you don't have an idea of who they could go to, make suggestions about what techniques could be used for helping them out with that. Here's a MBLEx-style question for us to go over regarding that content. A client scheduled for deep tissue work expresses concern about discomfort. What should the therapist do first? So the client is like, I know I want to get deep tissue massage done, but I'm afraid that it's going to hurt because I want those structures to be, I want to mobilize those structures because I want to mobilize those muscles and get oxygen into them and get them healthy again, but I'm afraid it's really going to hurt. So here's some choices that are outlined. I mean, I have my own opinion about how I would approach that, and that has all about respecting my client's boundaries. But here's some choices that we have laid out. A, explain the technique, the possible sensations, and modify if needed. So that's the wording of that question. B, proceed with lighter pressure without discussing it. And C, cancel the appointment. And D, tell the client discomfort is necessary for result. I don't like D because it's not respecting the client's concerns. B and C, which is use lighter pressure or cancel the appointment, is just writing off the whole situation. For whatever reason, it could be because the massage therapist can't do that kind of can't handle that kind of explanation, can't handle that kind of interaction or confrontation. So those aren't good choices at all because the client is not getting their work done and they're not understanding why. So A is explain how deep tissue massage works, what they might be what the sensation might be. Maybe it's not actually pain. Let's look at it as it's just information from the body first. And then as we're going, we're going to be talking about the pressure. How is this? We don't want to go above a 5 out of 10 for you. Anything more than that, anything you can't relax through is too much. And we talk about it and we make modifications. It's still deep tissue if you're accessing the structure. It doesn't have to be painful. So I would go with A, explain sensations, modify, let up a little bit if it's too much for them. We want them to have a good experience with deeper tissue massage so that their nervous system says, this is okay, this is safe. Next section, consultation and evaluation. So looking at the health history forms and talking about what you can do for them. So looking at the health history forms, what's been going on with their body so far and how you can help them. Active listening and clarifying, that means kind of repeating back a little bit and in your own words what they've been saying to you. If there's something that's questionable at all, make sure and ask clarifying, open-ended questions about it. All of this not only gives you more information to do a better job for them, but it also helps your client to feel safe with you because they can see that you really care about getting as much information from them as possible. It makes you look more professional when you try to get more information as possible. When you have the confidence and the skills to be able to talk to them, they feel safer. And then explain what you're going to do every time, or if you're with a client for many, many sessions and you're kind of doing the same thing for maintenance, then say, do you want me to do the same things that I've been doing last time? Clarifying that that's what's going to happen. I typically say the usual 60 minutes, because I have two choices, 60 or 90 minutes. The usual 60 minutes. That way there's no surprises 1 hour into it and they're like, oh, I need to leave. And I didn't ask. And they forgot to tell me. And I haven't been able to set up the session, or I haven't been able to plan the session according to 60 minutes. I planned it for 90 because they usually do 90. I didn't clarify. Okay. So here's a good MBLEx question for you, what to expect from that. Which question is most effective for gathering useful information during a consultation? So here are our choices. Does your shoulder hurt? That's a yes or no question. That's a yes or no answer, which is not an open-ended question. B, what movements or activities make your shoulder pain better or worse? What are you doing that makes it hurt? So now this is not in a blamey way. This is like, what actions are you doing, which helps you to be able to identify which muscles are bothering them. C, you injured your shoulder last month, right? Yes or no? That's not good enough. Okay. D, you don't have any injuries, do you? Okay. That's yes or no. So, I mean, just plainly, if you want to get through answering this as quickly as possible, if it's a yes or no answer, it's not good enough. So we want to be able to try to fish as much information as possible from our clients. What movements or activities make your shoulder pain feel better or feel worse? Active listening skills. That's what we need. Okay, assessment methods. We have visual assessment, we have palpation, and we have gait analysis. So visual assessment is when we're looking for postural imbalances like the head sticking forward, the shoulders are rounded forward, that's kyphosis. And all of this is kyphosis when it's the upper part of the body going forward. The extra curve is kyphosis. And then lordosis is when we have excessive lumbar curve. So like the booty sticking out more. There's a more curve. It's not just that they have a big booty. It's just like there's extra curve in the back. That's lordosis. And then uneven shoulders can be a spinal curve laterally, which is scoliosis. So we're looking for that kind of stuff. We're looking for hips being off. We're looking for anywhere where they're imbalanced. Palpation is when visual assessment, going on to gait analysis. I want to talk about that real quick. Watch them walk. And when we're in massage school, we're all taking turns, just like, go ahead and walk there and back for me. And that's not actually something that massage clients expect to see, to experience, because we're not physical therapists, so they're not expecting it. So I try to be a little bit more casual about it. I have a long hall that comes up to my massage room. And so what I'll do is I'll let them just walk ahead of me as we're going up to the room. I'm like, that it's that room up there on the left, and let's just go ahead and head down there. And I watch them walk while they're walking up to my room. And so I can see any kind of gait deviations in that way. So I watch for a short stride, a hip hike, or a foot eversion. Those are the kinds of things that I like to look for. So yeah, watching that lower body in gait analysis. And then finally in palpation, when we're actually able to get them on the table and feel their muscles, watch out for temperature, for whether or not the muscles are hot, the tone, any swelling, texture changes, things like that. So here's a good question for you. During an assessment, you notice the client's head is positioned forward with rounded shoulders. What's the postural deviation for that? A, kyphosis. B, lordosis, which is the lower back. C, scoliosis, which is to the side. And then flat back, which is the opposite of lordosis, is when you have the low back is totally straight, which means that you have like too much tension in the abdomen. And the answer would be A, kyphosis. We just talked about that. Excessive curvature of the thoracic spine. The thoracic spine is the upper back. The lumbar spine is the low back. Okay, so it goes, this would be the thoracic spine, kyphosis, and this would be the lumbar spine, lordosis. And then the last section of client assessment would be clinical reasoning, how you're synthesizing all of that information and implementing it in your decision making. So combine the information, blend what the client tells you with what you find in your assessments. So the subjective information from our subcharts, we've got the subjective information of what they say, and we've got the objective assessment of what we see. We put it all together and we talk with them, right? So if there are contraindications, like acute injuries or swelling in certain areas, we're going to watch out for that and make our decisions based on that. And then we adjust the plan during the session if necessary, and from session to session if they are returning. One last question in client assessment. If a client reports dizziness after the last session, what is the most appropriate next step? A, repeat the same treatment to test the reaction. Dizziness? Should we want to do that to them again? I don't think so. B, rule out contraindications and adjust the treatment plan. Okay, that could work. C, tell the client it's normal and keep going. Dizziness is not normal. Dizziness is not a good sign. D, refer the client without assessment. Well, that just means that you're not good for massage with me, so get out of here. So I don't like D because that means we're not even trying, right? We're not even like trying to figure it out. That's not professional. So we're not going to do that. C, tell them it's normal. That's not okay. That's writing off their concerns, and it's also unsafe. We could hurt. And then A, do it again, which is kind of like telling them that it's normal. So B, rule out contraindications. So you can ask things like, were there any medications that you're on that you didn't list? Do you have any conditions that you're aware of that could possibly lead to dizziness of some kind? And then, make some adjustments to help them to be more comfortable. You can also shorten the session. You can also keep them in a more upright position so they don't get so much blood to the head. You can use less pressure. There are a lot of choices that you can have. Always stay safe and always be responsive and adaptable to make changes for your client's comfort. Don't be risky. Real quick, just a little bit of housekeeping before we go on to discussing the next section and client assessment. I wanted to tell you about some freebies that I have for you for helping you to pass the MBLEx. The first thing I've got is a study guide that will talk about the different sections of the massage and bodywork licensing exam, and one of them being client assessment. It goes into details about the subcategories. Oh, sorry, microphone. It goes into details about the subcategories that you need to understand. It says 17% there. So you can check off every time you study something, you can check it off, and it will help you to stay on track to being ready for that exam. Ethics and laws, 16%. This is, oh, I did the math wrong. That would be 48% of the test if that's 16%. Anyway, so yeah, this packet is absolutely free. You can print it, or you can just keep a digital form that you can consult. I consult my digital form all the time when I'm creating this curriculum. Totally free, link in the description below. And I have a 100 question practice test. Now, this is test 2, which is part of the 10 test bundle that I have for sale. 10 100 question practice tests so that you can set a timer, do the 100 questions just like you were. You're simulating that experience of being in the MBLEx. Absolutely unique questions. I have 1,000 unique questions, 100 questions in each test. So that's for sale, but you can get a free version. Test 1 is absolutely free for you, so you can try it out and you can just get those extra 100 questions anyway. You can print it so that you can do the test, set the timer, get in a quiet space, and do the test. They're all multiple choice, just like the MBLEx. And at the end of the test, when you finished it, you can go through and check your answers, and you can learn just as much from what you didn't get right as you can from what you did get right. And then at the very end, there's an answer key that has all the different categories listed, and you can circle the ones you got wrong so you know which areas you need to spend more time, more focused study time, and which areas you can just kind of let go a little bit so you don't overstudy. I ended up overstudying for the MBLEx, and I don't want you to do that. And if you are brand new to this experience and you don't know much about how the MBLEx was created, how to apply for it, or you've been out of the loop for a little while and you can't remember how to apply for the massage and bodywork licensing exam, I have this mini course that will walk you through that step by step. And it also explains what to expect on test day, how to schedule the MBLEx and what to expect on test day. It's all outlined in this course. You can get it absolutely free. In the description below, there are going to be links to all of that stuff that I just talked about. Okay, going on to the second of these 3 sections. We're talking about ethics. Once again, I have a deeper dive into ethics in a video that I created 2 weeks ago. So go ahead and check that out if you want more information about that. But just real quick, we're going to go over the most important things that you need to know. Ethical behavior, professional boundaries. That means we don't discriminate. We treat all clients equally. We respect different cultures, different faiths. We respect their boundaries around modesty, respect their communication style. We respect what they need to be comfortable and feel safe. And then we're always sober. We don't go to work high. In many states in the US, cannabis is legal, but that does not mean that it's okay to be on cannabis while you're massaging. And definitely no alcohol, no other drugs. So, boundary examples. No personal gossip with your clients. Keep your relationships professional and therapeutic. So just act like a grown-up. This isn't high school. You're not in a salon getting your hair done. You're not doing their hair. You're not doing their nails. You're a licensed healthcare provider. So keep things very professional so that they keep coming back and personal boundaries aren't crossed. So let's do a question. Which of the following is the best example of maintaining professional boundaries? Here are our choices. A, accepting a date with a client after a session. No. Nope. In most states, you could lose your license if you date your client at all. And in some states, you're not supposed to date your client for years after your last session with them. So check your laws regarding that. But generally, as a massage therapist, dating your client at all ever is a no-no. B, sharing personal problems with your client. That's not, we just talked, right? C, discussing the treatment plan and limiting conversation to professional topics. And D, offering free sessions to friends. You know, as a professional licensed massage therapist, I've built my practice to the point where I don't really have time to work on my friends in that way. It's very nice if I'm able to free up a little bit of time to do trades, but you have to make sure that you document those trades as taxable income. The value of those trades is taxable income if you're going to do that. So, I mean, there is that, but I try to behave as a professional when I'm working in that capacity. So, yeah, like if you've got your massage therapist hat on in your massage space and you've got a dual relationship where someone that was a friend wants a massage and they're like, can I just get a massage from you because my back hurts? If you are going to be doing that, you just have to be really, really careful when you've got your massage hat on. However, if you're like lounging around with your partner in your home and your massage hat is off, then, do whatever you need to do. But many of you will find that you'll be so busy and so exhausted that the last thing you want to be doing is giving out free massages. So, moving on to the next section, therapeutic relationship. So we've got power differentials and transference and counter transference that we're talking about in the therapeutic relationship. So in a power differential, you as a licensed healthcare provider are in a position of authority as far as the social dynamics. You have the information and they don't. And then when they're laying on the table with clothes off, looking up at you, you are physically in a position of authority. So you have to always keep that in mind and try to even the playing field with your clients as much as possible so that they feel safe and empowered to participate in their care. You'll protect them from harm if they feel safe to speak up. You'll keep them coming back and getting the treatment that they need if they feel safe and respected in that power differential. And every client is going to be different regarding their personal histories and traumas when it comes to that power differential. So try to use your intuition and try to stay neutral and open-minded about what their needs are when they come in and while you're maintaining your position as a therapist. Now, transference is when a client projects their emotional stuff onto you, either positive or negative. A positive example of transference is a client has decided that you are their mentor. They put you on a pedestal and they want to ask you questions about what exercises you do, what kind of diet you have, so that they can be as healthy as you are. Countertransference, or a negative countertransference, is that client, let's say with a male and female, if the male client and the female therapist, the male client has developed romantic feelings for the therapist. They've projected some emotional stuff onto their therapist. And vice versa with a female client and a male therapist, could be any gender, but this happens much more often that a female client will project some of their traumas onto that male therapist, and anything that they might do that can push them even a little bit will result with the client believing that they've been abused in some way. So that's what transference is. The client has made those projections onto the therapist. Countertransference is where the therapist has projected onto the client. So the client has had trauma in the past regarding being in vulnerable positions with people that are larger than them or intimidating in some way, or clients that are pushy, and their experience with that gets projected onto new clients so that they might get the therapist might get triggered easily, and they might discriminate against their client in that way, either in a negative way or in a positive way. Like a therapist could develop a crush on their client. So that would be countertransference. So be very, very mindful in your interactions with your clients to be as professional as possible, to be as neutral as possible. If you sense that the dynamic is getting weird, make sure and adjust those boundaries so that they understand that, either subtly or directly, so that they understand that this is a therapeutic relationship, not going to tolerate pushing boundaries. So, let's see. A good question for this section. A client begins discussing deeply personal problems unrelated to massage. How should the therapist respond? So the client, it sounds like the client is transferring their hope that the massage therapist is going to be their emotional therapist. And perhaps the therapist in that case is counter-transferring their wish that they could be a mentor to someone, right? So giving personal advice, we don't do that as massage therapists. B, listen compassionately, but steer the conversation back to the treatment. That's a good one. We're like, okay, yeah, I'm so sorry you're going through that. That sucks. Oh my gosh. Well, take some big deep breaths and imagine that all of that is not here right now. And we'll just focus on this treatment right now. C, ignore the client. That's not going to make them feel safe. So we do want to listen compassionately. We want to acknowledge what they're going through. We don't have to give them advice, and we better not. Or D, suggest the client keep talking to pass the time. Yeah, we don't do that. So we're not their emotional therapist. We're not their buddy. And also, we don't want to be rude. We just want to just kind of gently steer them. I mean, stuff comes up when you're on the massage table and somebody's working through some physical stuff that's going on in my body. It drags up the emotional stuff. And I'm like, yeah, it's because this, and this happened. And the therapists that I've worked on in the past have been like, okay. And then they move on. Okay. Just acknowledge it. Dual relationships and misconduct. Think that my last ethics video is going to end up being demonetized eventually. So I want to be really, really careful not to do that in my future videos. I just wanted to be clear in my ethics video. But in this one, I don't have to do that. Misconduct, you know what I'm talking about. So dual relationships is where you have more than one kind of relationship. You have the therapeutic relationship with someone, but you're also friends with. You have the therapeutic relationship, but you're also a neighbor. You have the therapeutic relationship, but also, what else could it be? They do your hair. So know what those are and have healthy boundaries between them. Have your different hats on. You have a boundary that's, this is me being their hair client. This is me being their neighbor. This is me being, whatever. This is me being their massage therapist. Prohibition of any kind of contact. So any of that is not okay. We have the parts of our bodies that are not to be touched as a massage therapist unless it's in a therapeutic capacity with written consent and very specific boundaries about how that's going to be implemented. I don't need to go through all the details about what that is. You know what those details are. If you don't know what those details are, we got a problem. Always therapeutic touch, like reaching over and stroking their hand. Okay, that's not therapeutic. That's comforting, but it's not therapeutic, and it can blur those emotional lines. So always keep any touch that you have with an intention of using a specific technique for a certain outcome. And here's a question. Why should dual relationships be avoided? Here are our choices. A, they can blur professional boundaries and create conflicts of interest. B, they make sessions more casual. Why should they be avoided? They make sessions more casual. Now, that's not really specific enough. It just makes it, definitely less professional, but there are more specific answers we can be looking for here. C, they're always illegal, which isn't true. D, they guarantee better business. What is that? Is that a reason why it should be avoided? Dual relationships guarantee better business? Maybe in the short run, because if the person's happy with you, I don't know, if you're going around and you're making all these relationships with people and you're like, yeah, and I'm also a massage therapist, so come on over, good friend, and I'll charge you. Anyway, the answer just doesn't make sense to me at all. They can blur professional boundaries and create conflict of interest is the most specific answer for why dual relationships should be avoided. Let's see what I wrote for the explanation. A dual relationship is when you have another role with the client outside of the professional role. These can compromise objectivity and lead to ethical violations. The MBLEx stresses recognizing and avoiding them. Okay, next section, professional communication and scope of practice. So honestly, representing your credentials what you can do. Okay, so that's super important, either verbally in one-on-one interactions with people, being honest about what you can do, or in your marketing on your website, stuff like that. Make sure that the specifics about what you can and can't do, your scope or your credentials, are outlined so that nobody has the impression that you can do more than you actually can. Here's an example. I had a client that wanted me to use lymphatic drainage techniques on them. I am not trained in manual lymphatic drainage. I had some experience with it in massage school, kind of understand how it works. I have no experience with it. And this person actually has lymphedema. So when they said, I want you to use manual lymphatic drainage techniques on me, I had to say, actually, I'm not trained in it. My boundary is I'm not comfortable doing it at all. I prefer to just work on your upper body. If I'm going to be the one that's doing it, I can refer you to someone who I know has training in manual lymphatic drainage. But yeah, I could have been like, I could really use the money of doing that kind of work on a regular basis. Kind of learned a little bit in massage school about how it works. I can do it. That would be misrepresenting myself by being clear and specific about what I can't do. So work respectfully with other healthcare providers. So you're expected to be able to communicate respectfully with other healthcare people instead of being like, I don't like doctors. I don't believe in what they do. I'm not going to be nice to them. No, you got to be respectful and use proper communication with them. And then, scope awareness. We don't diagnose and we don't prescribe anything. We are supportive. We support the healing process while the client is also working with other healthcare practitioners on their path to healing and wellness. Here's a question. A client asks for advice on supplements to treat their arthritis. What should the therapist do? Do we prescribe? No. B, refer the client to a qualified healthcare provider, meaning like, do you have a doctor that could help guide you in finding the right herbal supplements or the right nutritional supplements? Or you could have a list of naturopaths that you could suggest for them. So none of those are good choices. We eliminated C, D, and A, and B is refer it out. That's not your scope. Supplements are not your scope unless you are also a qualified nutritionist or physician. Okay. And the last section, guidelines for professional practice. That is 15% of the exam. 15 out of 100 questions is going to be specific to guidelines for professional practice. So that covers the equipment, hygiene, sanitation, safety practices, and draping, your own self-care and managing your business, and then healthcare terminology. So the first section that we're going to be working on is the equipment, your hygiene and sanitation. So making sure that your tables, your bolsters, and your linens are always clean and in good shape. If you've got wobbly legs on your massage table, that's not safe for your client. If you've got cords coming out from under the table or across the doorways, those aren't safe. And just always make sure that you're being mindful of anywhere that your client is going to be sitting or crossing. Make sure there's not any obstacles around the table. Make sure there's enough room in your massage space to get around safely. Make sure that all the temperatures on everything, that if you're using hydrotherapy, the temperatures are safe and that you're being safe about all of that. Make sure that your lotion, creams that you're using are not spoiled. They're in good shape. Okay? Things like that. And then hand washing before and after every client. Simplest way to prevent spreading disease. And we need to know the difference between sanitation, disinfection, and sterilization. Sanitation is making sure that you clean all the surfaces that you or your clients are touching and washing all the linens. Anything that is washable needs to be washed. And then anything else needs to be wipeable so it can be sanitized. So we're just cleaning things. We're just kind of trying to get most of the pathogens off if we can. Disinfection is killing most of the pathogens, and sterilization is killing all microorganisms which is important when it comes to universal precautions. Somebody's body fluids, their blood, mucus, saliva, they vomited, things like that. Those always need to be treated as a possible pathogen for yourself. So that area needs to be sterilized properly. All right, so let's do a question. What is the best way to prevent disease transmission between clients? What do we do between clients to make sure that we're not spreading disease? A, wiping the table once a week. B, washing hands before and after each session. And make sure that we do our proper counting while we're scrubbing and the proper counting while we're rinsing. Doesn't have to be hot water. That's not necessary, but it does need to be washed. C, using the same linens for multiple clients. D, wearing gloves for every massage. Not necessary. That's overkill. Okay, safety practice draping. So I just talked about avoiding tripping hazards, keeping the equipment stable, and then draping, maintaining the client's modesty. Uncover only the area that you're working on. Don't reach under the drape for any reason. And we have to make sure that we're covering those most important areas: the breasts, the gluteal cleft, and the genital area. And then here's a tip. If a question gives you 2 technique answers and 1 ensure client comfort answer, always pick the comfort. That's really funny. Okay, so which is the most important goal of proper draping? A, to keep the linens clean. No, that's not the goal. B, to maintain client modesty and comfort. C, to speed up transitions between areas. Draping to speed up transitions. We're still going to have to wipe everything down even when we take the towels off or take the linens off. So that's not it. To D, to impress the clients with our technique. Well, you still might impress your clients with your draping techniques. It's pretty cool. We can do different drapes for different positions, but that's not the main goal. Remember, technique versus comfort. Always pick comfort. Making sure that they feel like they've been properly covered so that you don't see accidentally anything. All right, next section, taking care of your body and taking care of your business. So body mechanics, preventing injury by using your core strength, your leg strength, not just your arms, not your back. Making sure that everything's stacked, that your joints are stacked properly, and you're not using your fingers and thumbs too much. If you are, make sure that they're supported so that you're not overusing those ligaments in your fingers. And yeah, be super careful about shoulders when you're using elbow techniques. Be super careful that you're using your body to lean in and not your shoulder to lean in. Self-care, make sure you get plenty of rest, make sure you stretch, make sure you're hydrated, make sure you're fed, make sure you work out your own body to balance out those muscles that you're using in massage. And yeah, be careful of your schedule. It's not just about how you feel physically after doing a long day of massage, but how you feel mentally after a long day of doing massage. Because you don't realize what a strain it is on your emotional body, on your energetic body, until you start feeling really grumpy and you start feeling like you don't want to come back to work on people anymore. That's burnout. That's too much. And then you have to know for the guidelines for professional practice section, employment types, how to pay your taxes, business structures, that's corporations, LLCs, partnerships, and sole proprietor. You need to know the difference between property and liability insurance and retirement basics, which are like I talked about that in my video on weird things that you need to know for the MBLEx. So a massage therapist is experiencing wrist pain during sessions. What is the best first step? A, take a long vacation. I love that. Let's all go on vacation. B, adjust body mechanics to reduce strain. C, stop using your hands. Or D, ignore it and continue working. So we know A is probably not what they're going for, even though I really like that. D, ignore it and keep working, is not going to work. Stop using your hands. You might want to that day. That day, you might want to just be like, oh, I'm going to be really careful and not use my wrists. But just as you're starting to feel any kind of discomfort, that means you're not using not stacking your joints the right way. You're probably using your hands more like this than keeping those joints stacked. So adjust. And it becomes, the more you adjust your technique, the more it becomes just second nature. We call that muscle memory. Your body just does it automatically. It just won't do it. It's like sometimes if I like feel even just a tiny bit, I'm like, oh, yeah, and I just adjust. So now I don't even get wrist or hand pain anymore. My first year, I would get a lot of wrist and hand pain. Doesn't even happen at all for me anymore, even though I am a full-time massage therapist. You just get used to it over time. But you need to understand the theory of it for the MBLEx. And then healthcare terminology. So the purpose is for you to be able to communicate accurately on your SOAP charts and to be able to communicate with other healthcare providers so that you all understand what you're talking about. You need to be able to read the charts. When I worked in a clinic, I got intake information from the emergency room. And so the ER doctor scribbled all these notes, and I had to try to discern as much information as possible from their referral about why they were coming to me before they came in, so I would be ready to ask the right questions. This is where the terminology comes in handy, and that's why they want you to know that for the MBLEx. So understanding the prefixes and suffixes around the roots. So itis, meaning inflammation, myo, meaning muscle, and so on and so forth. There are many charts that will help you to be able to, I'm sure you got that in massage school too, to be able to memorize all of those. I'm going to try to, as soon as possible, get my medical terminology ebook and workbook out to you as soon as I can. So I'll have my own version of that for you guys to have. Planes and positions. So understanding where things are on the body. We've got sagittal, transverse, frontal. So all the different, let's see, sagittal, frontal, transverse. Then we've got anterior, posterior, proximal, distal, so on and so forth. We need to make sure that we know that. If the term isn't familiar, break it into parts. Often you can guess the meaning. And if you compare it to the other answers, possible answers on the MBLEx, you can discern which one isn't. Okay. So healthcare terminology, the prefix myo refers to which structure? We got A, nerve, B, muscle, C, joint, and D, skin. So let me see. Okay, so the root for skin would be derma. The root for joint would be arth, A-R-T-H. And then for nerve, the root would be neuro. So it's not going to be A, C, or D. The root for muscle would be maya or myo, typically, and it's a Greek root. Okay, and that is that. So these three sections account for almost 50% of your MBLEx score. So that is huge. If you dial this in, you are well on your way to passing the MBLEx. So focus on understanding the principles and applying them instead of memorizing. It just needs to be a part of who you are rather than something you're just like memorize. Okay. So if you've already been practicing these skills, you are well on your way. So that's a lot of reassurance. If you're currently in massage school, make sure you're practicing them as much as possible. If you're outside of it, try to implement it in your everyday life. Professionalism, being careful, open communication, and being able to take control of a situation while also being mindful and considerate of the feedback of the people around you. Once again, make sure and get your free resources. There's also a 10-test bundle so you can practice these questions again and again, which really sets you up for success in the exam scenario. Make sure and subscribe. Check out the other videos I've talked about so far and like the video. I appreciate that a lot. And I will see you in the next video. Toodaloo.